Hi everyone, welcome to class 2C. We're progressing from our sideline position into a supported plank. So come onto your right side. If you would like to have a couple of props nearby, the ball would come in handy. You don't need the towel roll and you don't need the block. So basically just a ball. Okay, so this time we're gonna prop up onto our right forearm and elbow. Left knee is stacked on top of right. And instead of having that 90-degree angle, we're now gonna bring our knees pretty much in line with our hips. They can be a little bit in front of or interior to the hips. Okay, from here, if you're able, press down into your forearm, inhale. As you exhale, lift up into a supported side plank, okay? So stacking left hip on top of right. And if you want, you can take a little bit of a curve down of your left shoulder. This actually helps engage the obliques if we take this tiny little turn downwards as opposed to stacked, okay? So you might feel your right obliques turn on a little bit more with this. If you're feeling comfortable here, inhale into your back body, down into the pelvic floor. As you exhale, press into the ball, contract from the bottom up, and then bring your left knee into your chest. Inhale, stack your left knee on top of your right, let go of the press. Exhale, press into the ball, contract core and pelvic floor, left knee into chest. Good, inhale to release. Exhale, press into the ball, maybe curl your left shoulder down, and then hug your left knee in towards your chest. Good. A progression, if you would like, is to lift off of your bottom knee. So we're still coming into a side plank supported on our elbow instead of our hand on the right side. But if you're ready, you can lift up on an exhale and then press into the ball. Bring that left knee into your chest in this side plank with the right hip lifted. Okay, just a progression to work on. We'll switch sides for a few reps. So come laying onto your left side, rest onto your left forearm and elbow. Right knee is stacked on top of left, and our knees are just slightly in front of, if not in line with our hips. From here, right hand presses into the ball, into the mat, and maybe take a slight curl down of your right shoulder towards the mat. Again, you can experiment. You might feel it better if you're totally in line, but a lot of times turning down a little bit really gets the obliques more involved. Okay, so from here, inhale, 360 degrees, and then exhale, lift up into your supported side plank. So balancing on the left forearm and the left knee as you press your right hand into the ball. If everything looks good here, we're avoiding any doming or coning through the midsection. Our TAs are turned on, which means it's a little bit firm in this area on the inside of your hip bone. So breathe in here. Exhale, push your right hand into the ball. Contract from the bottom up and pull your right knee into your chest. Inhale, release, right knee on top of left. Let go of the ball press. Big breath into the rib cage. Exhale, push into the ball. Core and pelvic floor on. Hug your right knee into your chest. Inhale to release. Maybe lift a little higher through that left hip. Exhale, curl right shoulder down, press right knee into chest. Good. If you'd like to take one rep of the progression, stack your right foot on top of your left. Inhale to kind of reset. And then exhale, lift your hips up, lift your knees up, press into the ball, right knee into chest. Okay, this is your progression. Perfect. Okay, I will see you for the next class as we integrate a little bit more in this side lying position.